Hello and good day, everyone. We, the Group 2 members, will going to present to you our comprehensive research all about abortion with the guide of the six scholar thinking hats.
What is abortion? Abortion is defined as the removal of a fetus from the uterus before it reaches viability. In human beings, usually about the 28th week of gestation.
There are two types of abortion, spontaneous abortion and induced abortion. Spontaneous abortion can happen naturally, also known as miscarriage. It is the loss of pregnancy naturally. It happens in roughly 30% to 40% of pregnancies. Although abortion prevents of childbirth, it is not considered birth control or another term for contraception. Induced abortion. Induced abortion, it can be forced or voluntary termination of pregnancy that preventing the vital development of the embryo or fetus for its elimination. WHO provides global technical and policy guidelines on contraception to avoid unwanted pregnancy. Abortion care, abortion management, including miscarriage, induced abortion, incomplete abortion, and fetal death, and post-abortion care.
Abortion is a basic medical procedures that can be professionals, medication, or surgical procedures. Abortion is a safe healthcare intervention when performed using a WHO recommended procedures that is appropriate for the pregnancy durations and by someone with the requisite expertise when people with unwanted pregnancies are unable to obtain a safe, quick, inexpensive, geographically accessible, respectful, and a frequently resort to unsafe abortion. Non-discriminatory abortions, they frequently resort to unsafe abortion.
In the modern world, where abortion in other countries have been legalized, some individuals agree but most disagree. Technically, it is still a wrongful act taking one innocent life from an unborn child. How many infertile people are dying to have a child? The act is not just. Come to think of the innocent life being taken. She could be someone in the future. There are lots of different emotions that can be felt after an abortion, miscarriage, stillbirth, or adoption. Some people feel a sense of sadness and relief at the same time. Others feel anger, fear, or anger towards the person who carried the fetus to term.
Expressing your feelings is crucial to emotional health after an abortion. You are entitled to a grieving process. Honor your experience so that you don't push it down or try to express or forget it. Some people seek out professional counselor or spiritual advisor so they can better sort out their emotion after the procedure. Grief accompanies all the major changes in our lives. When we realize that we have grieved forever and recover this time as well, it is more natural to recover than to halt in the track of grief forever.
A medical procedure that terminates a pregnancy is known as an abortion. It is a basic healthcare requirement for millions of women, girls, and others who may become pregnant. And while it may be harmful to others, we cannot rule out the possibility that it will be beneficial to the woman who carries it. The most common reasons for abortion are lack of funds, a lack of mental and emotional readiness, uncertainty about the chosen partner, and disruption of education. And each of these arguments is valid because having a child entails a great deal of responsibility.
Abortion is one of the safest procedures that medical professionals perform with precision when it is legal. Women can have abortions in places where it is legal if they can convince doctors that they have certain medical conditions and that abortion is the best option for their physical and mental health. In some medical situations, where the mother's life is at risk, abortion may be a better option. Medical emergencies can sometimes force a woman to abort her child. Medical professionals may advise a woman to have the procedure done in order to save her life rather than dying while giving birth. It appears that saving the mother is more rational than allowing both of them to die.
There is persistent discussion among a large number of people regarding whether or not abortion should be legalized. Some people believe that abortion is very wrong and that it should never be permitted under any circumstances. Others believe that the parent should have the right to choose and that it is not murder until the baby is born. However, there are a number of laws that govern the legality of the matter, and abortion is legal as many as 30 countries. Abortion is morally acceptable in some countries while it is not in others. The discrepancy is largely due to differences in socioeconomic conditions, the role of women in society, and the level of education in general across nations.
Abortion has been equated with murder by a variety of religious and social reform movements. Protests and negative portrayals of abortion as a topic are common. People who commit such as place undue pressure on women contemplating abortion, leading to depression and other mental health issues. Abortion is viewed as a taboo topic by many people, so the patient bears more psychological burden than with any other medical procedure. As a second consideration, repeated abortions may reduce or completely eliminate the chances of conceiving in the future. As a result, when a person is trying to get pregnant, the consequences of some of their more callous actions from their younger years are more severe.
Abortion is often the only option for a few people, no matter how harsh it may sound. Abortion allows rape victims, especially minors, to avoid the burden of raising an unwanted child. This is especially true for those who have been raped. It's been shown in case studies that many abortions are actually helpful in the recovery of rape victims from the physical and psychological harm they've been subject to. For those who get pregnant by accident and have no means of supporting a child, abortion is the only option. It relieves many victims of the responsibility of raising a child, especially when they face a financial hardship and other social issues.
So abortion. Many of us define it as one of the most sinful activities that woman does. Many disregard and hate women who choose to terminate their pregnancy and end the life of a child living in their body. As we conducted this topic, we cope up with new ideas why abortion grows and keeps on happening nowadays. Sexual harassment or rape and health issues. These are the things that might be a reason, yet many of us keeps on being blind. These reasons may be the things that urge them to abort a child. A personal traumas from harassment or rape might urge them to end pregnancy, for it reminds the child of their filthy experiences.
As you try to learn more about abortion, you don't just only thought about one thing, which is a woman is not yet financially prepared to raise a child. There's also a lot of reasons for a one thing to happen. And for us to be able to provide a resolution for a certain issues or problems that are happening in our society, we must not look for the outside of an issues. We must also dig deeply inside what are the reason, or why does it happen, why does it grow in our society. For us to understand those experiences, those issues, those concerns that's happening in our society, for us to be able to help, and for us to be able to conduct a resolution, for us to eliminate or prevent this kind of issues or problems happening in our society, especially this topic, which is abortion, which is one of the relevant topic that we must dig inside.
Abortion has remained a continuous moral, ethical, and legal problem, despite the fact that there are some countries has recommended safer and legal abortion methods and even legalize it. Hindi lahat ng bansa may available na contraceptives, may mga areas, countries lang na mayroon nito. Also, according to the study, the number of abortions worldwide is declining due to increased access of contraception. There are 72 countries na permitted ang abortion. Kabilang na dito ang Australia, Canada, China, France, and Singapore. There are 24 countries naman na ban ang abortion. Kabilang na dito ang Philippines, Iraq, Laos, San Marino, Jamaica. Modern surgical techniques are used like the pill to maintain the life of the woman in the normal way. These safe methods protects the mother from the long-term psychological and physical consequences of abortion. Mayroong abortion pills or medication pill. This pill is a safe and effective way to end an early pregnancy. Ang effectiveness nito ay dumedepende on how far along you are in your pregnancy when you take the medicine. Medication abortion is similar to a miscarriage. The decision if and how to terminate a pregnancy has a lot of reasons, like if the woman is a victim of rape or incest. The reasons why women get abortions are varied and personal. Some were in abusive relationships and other were not ready to be a mother. Dito sa atin sa Pilipinas, kahit biktima ka ng rape or incest, hindi mo pwedeng ipa-abort dahil na rin sa batas at simbahan. Pero there are some cases na imbis na ipa-abort ito, pinapaampon na lang because rape or incest can be turned into a trauma to the victim.